Welcome back to Chibi Medicine. Today we are going to be talking about bulimia and binge eating disorder. Right? So if you haven't seen the anorexia video, please check that out. It will make things a little bit easier. Right? So, what's bulimia? Right? So you have these patients who eat uncontrollably. They take in as many calories as they can, but they also have compensatory behaviors such as vomiting, right? So they're trying to get rid of those calories or the food that they've taken in. So they can use vomiting or laxatives. They can also go on fast, like a couple of days. Right? And also, they can exercise excessively to try and get rid of the fat. Right? Now, how are you going to differentiate this from the binge eating, purging type of anorexia? These guys usually have normal body weight, right? So in bulimia, there's usually normal body weight or even elevated sometimes. Right? Now, in terms of the frequency you need to see to classify people as bulimic, they need to have those binge eating or compensatory behaviors at least once a week for 3 months. So that's the criteria for it. All right. Now, in terms of clinical features, like we mentioned, they will have a normal BMI or an elevated BMI as well, right? You can see parotid gland swelling, right? And what would this be, right? So if people are trying to throw up to get rid of the food that they just ate, they're also going to throw up all that stomach acid, right? Which has HCl in it. Now the exposure to that acid is going to cause inflammation of the parotid glands. So that's why you see parotid gland swelling. Dental enamel erosion, same principle. If you have an increase in exposure to other HCl, it's going to erode your enamel, right? Now, Russell's sign is a bit different. Well, it's still under the same principle, but it's a bit different in that, okay, how are you going to throw up if you want to get rid of the food? You're going to stick your hand in your mouth, right? So the teeth can cut into the back, like the knuckles, and so you're going to see that scarring on the knuckles. Like you can appreciate that in the picture over here. Okay. Now on labs, you can see hypokalemia because part of what you're throwing up is also all that potassium, and metabolic acidosis. If you're throwing up all the acid, it's going to have to be replaced in the stomach, and you're basically getting rid of acid. So what we're going to have is alkalosis, right? Metabolic alkalosis, right? I mean, in a way later video, we're probably going to have a video around metabolic alkalosis or acidosis or respiratory alkalosis and acidosis, but that's for a later time. Okay, how do you treat bulimia? So talk therapy, right? Cognitive behavioral therapy. And then in terms of pharmacologic management of it, fluoxetine, which is an SSRI, tends to work pretty good. Okay. Now you need to watch out for the electrolytes, especially if they are throwing up, if that's that compensatory behavior. Right? You also need to look for evidence of suicidal ideation, because then you might have to hospitalize the patient. You would have to hospitalize the patient, right? In that situation. Now, avoid bupropion. So this is like it's like an atypical antidepressant. So atypical antidepressant, right? And it works great because let's put it this way: if you start someone for depression on SSRIs, a side effect of SSRIs can be weight gain. So if they're complaining about that, you can or if they're complaining about maybe decrease in sexual activity or kind of sexual what do you call it, like arousal, because that's a side effect of SSRIs, you can switch them to bupropion. Now, in anorexic patients and bulimic patients, bupropion can lead to seizures. So you want to avoid that with these guys. Okay. Now, for binge eating disorder, you're still taking in a ton of calories, except this time there is no compensatory behavior. Right? And in terms of the frequency of the binge eating, to classify it as binge eating disorder, it should be at least once a week for about 3 months. Okay. Clinically, they're going to be overweight. Again, no compensatory behavior, right? So they're going to be overweight or obese. You can imagine it's a disorder, right? And a disorder, by definition, in psychiatry, should disrupt your daily living or should disrupt your mental health. So they could end up with depression and anxiety. Usually, when you treat eating disorders, all these other comorbidities such as depression and anxiety tend to go away. All right. So they're also prone to getting diabetes. So that's something you need to know. In terms of treatment, the first one is cognitive behavioral therapy as well, right? So most of psych first line is going to be cognitive behavioral therapy. Okay. In terms of medications, you can go with an SSRI like sertraline. You can also go with lisdexamfetamine, right? So this is an amphetamine, a stimulant, usually used for ADHD. And if you remember, the stimulant medications for ADHD, the side effect of them is decrease in appetite. So you're basically using it kind of for the side effect. Okay. So Pimerate is like an anti-seizure drug, but you need to be careful with this, right? So you're also using this for a side effect of decreasing appetite, but it also has a ton of other side effects, right? So it can give you some sort of brain fog, so cognitive issues. So brain fog, right? It can also cause formation of kidney stones. So kidney stones. It can also cause glaucoma. So you can see why most people probably avoid using this for treatment, right? Okay, and also it can increase thoughts of suicide, so suicidal ideation, right? So that's pretty much it. And so I tutor, by the way. So if you need some tutoring, just leave that in the comments. And see you in the next one.